Last week, a patient came in and said, "Doctor, I almost canceled this appointment because I felt fine." By the end of our visit, we had found something important that deserved attention. That reminded me why routine checkups matter, and is exactly why I wanted to make this video. Have you ever wondered what your doctor is thinking the moment you walk into the exam room? Most people believe the physical exam begins when the stethoscope comes out. But as primary care physician, I can tell you that's not true. In many ways, your physical exam starts before either of us say a single word. Not because we're judging you, because we're trained to observe. Today, I'm going to share 7 things your doctor may notice before the exam even begins and why those observations matter. Hi, this is Dr. Gani. One of the most rewarding parts of primary care is that I often care for patients over many years. That means I don't just know your medical history, I know your normal. So when something changes, even something subtle, it catches my attention. So let's walk through what doctors are really observing before we even begin the physical exam. Number 1, how you walk into the room. The very first thing I notice is how you move. Are you walking comfortably? Are you limping? Do you seem unsteady? Are you holding onto furniture? Do you have difficulty getting onto the exam table? These observations help us understand your balance, strength, motility, pain, and even your confidence. Sometimes a simple change in the way someone walks is the first clue that something deserves a closer look. Number 2, how you're breathing. Next, I pay attention to your breathing. Can you speak comfortably in full sentences? Do you seem short of breath just walking into the room? Are you breathing faster than usual? Do you have a persistent cough? Many people don't notice gradual changes in their breathing because they adapt over time. As doctors, we're trained to notice those changes. Number 3, your face tells a story. Our faces often reveal things before we say them. Do you look uncomfortable, tired, anxious, pale, in pain? Of course, none of these observations alone make a diagnosis, but they become part of the bigger picture. Medicine is not about one clue. It's about putting many clues together. Number 4, your skin. Your skin can tell us a lot. We notice color changes, yellowing, paleness, rashes, bruises, swelling, dryness, new moles or lesions. Most skin findings are completely harmless though, but occasionally they point us towards something that deserves further evaluation. Number 5, how you talk. Conversation is one of the most valuable parts of a doctor's visit. I notice how quickly you answer questions, whether your speech is clear, whether your memory seems different, whether you seem more withdrawal or more energetic than usual. Sometimes the conversation tells me more than one test. And that's why I encourage patients to speak openly. Number 6, your vital signs. Now we start collecting measurements. Blood pressure, heart rate, weight, temperature, oxygen level. Individually, each number is helpful, but together they help us understand trends over time. One reading rarely tells the whole story though. Patterns do. That is one reason annual checkups are so valuable. Number 7, what doesn't fit. This may be the most important one. Doctors are trained to recognize patterns. But we're also trained to notice when something doesn't fit. Maybe your symptoms don't match your exam. Maybe your energy seems very different from your usual self. Maybe one small detail makes us ask even more questions. That extra question is often what is important to discover. Medicine is not only about finding disease, it's about staying curious. People sometimes tell me, "Doctor, I didn't think that was important enough to mention." Please don't make that decision for us. Just tell us. The smallest details can sometimes complete the puzzle. And remember, your doctor is not looking for ways to judge you, we're looking for ways to help you. Every conversation, every observation, every question brings us closer to understanding your health. So the next time you come in for a visit, don't worry about saying the perfect thing. Just be yourself. We'll take it from there. And as always, this is Dr. Gani wishing you good health.